and welcome to our first interview of the Pelvic Health Summit. I'm sitting here with Dr. Allyson Shrikhande. Allyson is a board-certified physical medicine and rehabilitation specialist, the chair of medical education in the International Pelvic Pain Society, and the founder of Pelvic Rehabilitation Medicine, where she treats patients in New York City and New Jersey. Welcome.
Thank you so much, Pamela.
So I just kind of want to start off right off the bat. Can you tell us a little bit more in definitive terms, what is pelvic health, what is pelvic pain?
Sure. So pelvic health is the concept of taking care of your pelvis. The pelvis is a multifaceted area of the body with many organ systems coming into play. We can break it down into multiple parts. The gastrointestinal is important, so your nutrition plays a role. Preventing constipation is extremely important in pelvic health. There's also the urinary aspect of pelvic health, so bladder training, staying hydrated. Low sugar diets can often help with this. Then there's also the gynecological aspect of pelvic health, and it's important to have a primary gynecologist on board, have regular checkups, and keep that evaluated. And there's also then the musculoskeletal aspect of pelvic health, which is the muscles and the joints of the body. So the idea is really to keep the pelvis strong and working well.
Awesome, thank you.
Yes.
So will you tell us a little bit more about what you specialize in this very big field that's emerging?
Yes, so within pelvic health, I specialize in pelvic pain, male and female pelvic pain. And really the idea is when certain things can in that system go awry, and we help treat the muscles and the nerves that can cause pain for patients, as well as the joints. And the joints of the pelvis, so they include both hips, they include the front joint, which is called the pubic symphysis, they include the coccyx or tailbone, and the sacroiliac joint as well, which is in the posterior aspect near the sacrum.
Very cool, thank you. And so people who might be watching here, where do these symptoms start to develop? Is it painful sitting? Where do people generally start knowing, I'm in pelvic pain, this isn't just a normal feeling or some discomfort?
So every patient is different. With the most common would be pain with your menstrual cycle, severe debilitating pain where you have trouble maybe going to school or going to work or going out with your friends, because when your menstrual cycle comes, it is very debilitating. So that would be one thing that we do see. Another is pain with intercourse, either pain during intercourse or even pain post. Some patients don't have discomfort until hours or days after, male and female. Also, pain with sitting is extremely common in the pelvic world. When you're sitting, you're putting pressure on the fascia, the muscles, and the nerves of the pelvis, and quite often this repetitive sitting can stimulate symptoms. So that is also extremely common. In addition, we see a lot of urinary symptoms in the pelvic world. Urinary urgency, frequency, where you have to urinate a lot, or you have trouble sleeping through the night because you have to urinate a lot. So that can be related to obviously your bladder, and your pelvic floor muscles can irritate the bladder. And lastly, we would see a lot of bowel issues. Patients have a lot of constipation and or pain when they have a bowel movement, and or loose stools, or frequency of bowels is what we call it. So we see that quite often as well.
Thank you. Yeah, it's very broad range, and we're going to be talking about all these specific topics in different interviews. So tell me a lot about the research that you've done both in the past and what you're working on right now that is related to all of these pelvic pain and pelvic health issues.
Sure. So currently we're excited to be part of the ROSE trial for endometriosis. And essentially the concept there is to diagnose endometriosis through either menstrual flow or blood work without having to do surgery to diagnose it. And the ROSE stands for Research Outsmarts Endometriosis, and it's extremely exciting and really could be life-changing for women in the future. So we're co-investigators on the ROSE trial. In addition, we are IRB approved through the Feinstein Institute for the protocol that we have created. So we're evaluating pre and post functional pelvic pain scale for our patients that are undergoing our protocol. And lastly, we're investigating regenerative medicine for treatment of the muscles and nerves of the pelvis, with the whole concept of decreasing inflammation and healing the muscles and nerves of the pelvis. So those are our 3 current research projects that we're doing.
Super cool. That's so exciting. And I'm going to be linking all of the research in the page, so you'll be able to find more information on that. You hit a little bit about the protocol that you specialize in your practice. Would you mind telling us a little bit more about that?
Sure. I mean, the idea behind it is for patients who have tried physical therapy. We always start with pelvic physical therapy. And if that's not enough, then we add our protocol. And the idea is really to create blood flow and to create space in the pelvis, as well as calm down inflammation in the pelvis, particularly around the nerves, which are inflamed. So what we're doing is external ultrasound-guided trigger points to the different muscles of the pelvic floor sling and the different small peripheral nerves, hydrodissection peripheral nerve blocks. And it's a series with physical therapy. The overall result is to decrease inflammation and increase blood flow and make your muscles longer and stronger and make the nerves calm and happy.
Wow, that sounds great. Fabulous. So I want to know a little bit more about what inspired you to get into the field and specialize the way you have.
Sure. So during my first pregnancy, I had some issues myself, particularly with my pelvic floor and sacroiliac joint. And to the point where I had some difficulty walking at the end of my pregnancy, and postpartum had a lot of urinary urgency, frequency, issues with that ended up being pelvic floor. And I sought help from an amazing, excellent pelvic floor physical therapist, and I read more and more about the pelvis, and then the more I learned, the more I realized it's a field that really needs a lot of dedication, a lot of attention. A lot of women at this point still feel ashamed to talk about it, and so I've really wanted to help raise awareness, let women know, don't be ashamed, it's okay, you're not alone. And now really for the men too, don't be ashamed, you're not alone. It's very, very common, and that's how I got into it.
Fabulous. And that's really the point of this summit as well, to normalize pelvic health and pelvic pain conditions.
Exactly.
So do you have a message for our audience, and is there a myth that you often hear surrounding pelvic health and pelvic pain conditions that you'd like to address?
Yes. So the most common myth that we would hear is, it's in your head. The MRI was normal, the blood work is normal. It must be in your head. And we now know that is not true. There are a lot of underlying pathologies that can occur that at this point we're not able to diagnose with any medical test. So it is not in your head, and I would suggest you see a pelvic health specialist who is aware of the diagnoses and can explain what's going on.
So you mentioned that there are some medical tests that don't exist yet to diagnose these things. Can you talk a little bit more about the future research that you're hoping to do, and also where you see the industry going?
Sure. For pelvic rehabilitation medicine, future research that we're hoping to do and we're applying for now is to measure the patient's inflammatory markers before our protocol and then after our protocol to see the decrease in inflammation in the body. So we're trying to do that right now, which is very, very exciting. And the way I see the research going is essentially really taking the whole biopsychosocial approach to pelvic pain and really seeing the treatment modalities coming from the central part of your body, the central sensitization, the brain and spinal cord. So there's a lot of research going on with functional MRIs currently, evaluating the role of the brain in pelvic pain. So that is extremely exciting.
Wow. So, as the chair of the Medical Education Committee for the International Pelvic Pain Society, can you tell us a little bit about your role and how you're bringing your current research and your future research into that role?
Yes, the main role at this point is really to help raise awareness and educate other medical practitioners so that they will be able to recognize certain symptoms in patients early and get them to pelvic health specialists. Because really, the earlier pelvic health specialists see a patient, the better. It's a lot easier for us to treat when we see them in an earlier stage. So that is really the role, to raise awareness and let them know that there is help, there is specialists within multiple fields, and within physical therapy, within the GI system, within the urinary system, within the gynecological aspect, and also physical medicine and rehabilitation doctors. And in pelvic pain really is a team approach. It's a multifaceted, complicated condition with a lot going on in one area, and really the team approach is the key. So I really do urge practitioners throughout the country to really find good physical therapists, good GI, GU, and gynecologists and physical medicine rehabilitation doctors to work with.
Fabulous. And just talking a little bit more about how early intervention is best, can you tell our audience a little bit more about ways that they can prevent pelvic pain conditions or also manage their pelvic pain?
Yes. So the best way from the musculoskeletal standpoint for prevention and management of pelvic pain really would be through yoga. And the reason why I say yoga is it really does everything we asked our patients to do in one. So breathing is extremely important. With proper breathing, we call it diaphragmatic breathing, you're resetting the sympathetic, parasympathetic systems.
So essentially, show me that?
Yes, sure. Okay. So what you want to do, I usually teach patients lying down, but you can also do it sitting up.
Okay, we'll sit up.
So basically I say you breathe like when you're a baby. So when you're first born, you breathe perfectly. And then we teach ourselves to not breathe perfectly. But you want to take a deep breath in, and your belly should go out. Breathe out through your mouth, and your hands should drop. Deep breath in through your nose, and out. One more time, in, and out. So the key is you do want to keep, if you're lying down, you keep your hand, but you want to see your hand lift up and down, up and down. Some patients put a ball, but you really want to lie down and just watch it. And I say do it morning and evening. Twice a day, takes about 10 to 20 seconds. Everyone has 10 to 20 seconds, but it really helps calm your nervous system down. And in addition to that, it actually, when you're breathing properly, forces your pelvic floor to open up. Oh, wow. So it really helps you lengthen the muscles of your pelvic floor and retrain them not to get contracted down. So that twice a day breathing is extremely important, and yoga builds that in. So it builds in the breathing, the meditation, but in addition it also builds in the strength and the flexibility that your pelvis needs from the musculoskeletal standpoint. So it gets you stronger, more flexible while doing the breathing that you need to do. So it's an all-encompassed, all-in-one, low-impact way to really prevent pelvic musculoskeletal issues. Yes.
Well, I definitely feel more relaxed now after doing it, so I'll have to take that on. So can you tell us a little bit about the patient journey when people come to pelvic rehabilitation medicine?
Sure. Yes. So when patients come to see us, essentially we are listening to their story, and what we're trying to do is figure out the primary underlying cause of their pelvic pain. And as we had mentioned, there are multiple organ specialties within the pelvis as well as the musculoskeletal system. So really we're trying to decipher the primary cause if there is one. And our evaluation is comprehensive. We're looking at patients' lumbar sacral area, we're looking at the sacroiliac joint, their hips, we're looking at their lower abdomen, and we're also looking at their pelvic floor muscles and nerves. And essentially we decide if imaging is required and if what specialties, if any, we would need to bring on board on our team. At times it would be the GI doctor, and sometimes we want to send to the genitourinary doctor, or sometimes we need the sports hernia specialist if required. So we are always wondering what team we need to build. We do almost always work with physical therapy, and we really do always have that biopsychosocial team approach when patients come.
Awesome. And so for some of our viewers and practitioners who are watching, who maybe aren't located in this area, what are some resources you can recommend for them to find different practitioners to kind of build out their own holistic team?
Great. So the International Pelvic Pain Society, their website is excellent, and they have a tab where you can find resources in your area of practitioners. So that is excellent. I would go there first. And in addition, there are some patient education handouts that we're currently working on updating, but that is an excellent resource. In addition, there is the Coccydynia Society, which is also an excellent resource. The Interstitial Cystitis Society is also an excellent resource for practitioners in your area. And also the EFA, Endometriosis Foundation of America, is also an excellent resource. Those would be the top resources that I would recommend.
Awesome, thank you. We will link all that information in the community page, so you can just click the link and start your research for people viewing who are finding support in this group, but also might need more resources to find communities related specifically to their pelvic pain condition. Can you recommend any further resources or specialized groups?
Yes, the pudentalhope.org is also an excellent resource for patients online, and they also can help connect patients with practitioners in their area.
Okay, fabulous. And I know that, the pelvic floor and that whole region can be very complex. How do you talk to your patients about those complexities and also the mental, emotional, and social ramifications that often come with pelvic pain conditions?
So when talking to patients, we do break it down into describing the nervous system from above and below, as well as the muscles and the joints. And the overall idea of really patients who have pelvic pain for a certain amount of time, we describe it as their dial has been turned up, and we're really just trying to turn down your dial to calm things down. That's really how we like to describe it. And in addition, we really want to open up that pelvis, and we want to let blood flow in, and we want to get patients' muscles longer and leaner and stronger, is really the overall concept. And really, for patients, we really are focusing on quality of life, and really whatever is bothering you, we really want to focus on making your quality of life better and living a fulfilled, happy life. And overall, we do like to keep patients active and moving as much as we can.
Can you speak to a few low-impact exercises that you often recommend to your patients? I know you mentioned yoga before. Are there any others?
Sure. Swimming. We love swimming because swimming really develops the cardiovascular system and really gets your muscles strong without that constant impact on the lumbar sacral spine and the pelvis and the hips. So swimming is excellent for almost everybody. In the pelvic world, we do try to avoid biking, as biking, the pressure with sitting can often irritate the muscles and nerves of the pelvis. So that is one that we often do try to avoid, at least at first, while patients are kind of in pain, and then we can work to it eventually. And one thing we do love is just plain walking. Walking is wonderful. So walking, preferably not on cement, on softer ground, such as walking in the park on the grass is better, but walking overall is excellent. And then we do discuss Stairmaster and the elliptical based on every patient's progress and how they're doing.
Awesome. So it's very individualized, holistic approach, I'm hearing.
100% individualized.
Can you share with us a few examples of patient success stories who have come through pelvic rehabilitation medicine?
Sure, I'd love to. One that comes to mind, we are lucky enough to see people from all over the country and sometimes outside the country. And there was a patient who came from India and essentially had gone through multiple surgeries and multiple treatments and really couldn't figure out what was going on. And essentially, in the end, her pelvic floor was in complete spasm. So between physical therapy and our protocol, as well as yoga and some nutritional changes that were made from her constant lower abdominal pain and constipation. Really, she did extremely well and went home and really has told multiple friends, and now we have patients coming in from India from her success story. So it's been really exciting to help her and great to see. In addition, another success story that would come to mind really is under the endometriosis umbrella, where we see patients who've had pain for many years and this debilitating periods and really couldn't find out what was going on. And we're lucky enough to have amazing specialists in the area. So really, she had a proper excision surgery with a local specialist in New York City, and the endo was removed, and then we did treat her pelvic floor muscles and nerves after surgery with physical therapy, and she is doing excellent. It was at the point where she really was not able to complete law school at that time because of the pain, but now she's back in law school and really doing amazing, living a fulfilled, wonderful life. So that's always exciting to see. Lastly, there'd be one, it would be maybe from the male standpoint, presented with pain with intercourse, pain with urination, really ended up being a combination of a hernia, inguinal hernia, and labral tear in the hip. That combination can really eventually present with pelvic pain after going on for a long time. So after fixing both his hernia, his hip, we did address the pelvic floor muscles and nerves with physical therapy, and he's doing well.
Fabulous. Well, those stories are so inspiring to hear. Do you have a message of hope for our viewers today who might be struggling or in the midst of a diagnosis?
Yes. People do care. We are raising awareness, and the medical community is really starting to put more and more focus on pelvic pain. The research is coming. We will get there. Just give us some time, and really it's an exciting time, and I'm just happy for the patients to finally get the attention that they deserve.
Awesome. Thank you so much.
Thanks.
Thank you so much for joining us. Now I'd like to hear from you. Please share with us one takeaway from the interview in the comments below. Give us a like and share this group with someone who you think will benefit. Thank you.